Hello everyone, my name is Dr. Carlos Diez Acero, specialist in orthodontics. I'm practicing in London and in Madrid. I'm also privileged to be one of the key opinion leaders at Medimax Laboratories, where I will be leading the aligner course. If you want to learn more about aligners, please feel free to contact our Medimax team to join us in this course.
All we need is somebody to lean on.
Perfect. So here we have the attachment template. Okay, you have the model. We just need to take it out. This is what we will use to transfer the attachments into our teeth. Okay, here we will preload the attachments with the composite, what we will show you later. Okay, with these two things. Then here you can see the model. Okay, where we are gonna bond the attachments. We will use this model where we will place the template. Then we have this gun. This gun is normal gun where we use the composite just to load it and to do the attachments. Here you have the composite, and then here this is the composite. Normally the color we like to use is the A2. The shade is the most common and is the best for the attachments, so they will be like kind of white for the patients. So what we do now here is just load the gun with the composite. Okay, like this. We have everything ready. So we will start loading all these spaces that we have ready for our attachments. Okay. Once we have all the composite in the attachments, okay, we just press all of them, yeah. And we will see here the excess. What we will need to do is just with the plaster, remove the excess, make sure we just leave the composite, okay, in the hole, no more, no less, yeah, but leave it a tiny bit extra to be sure that it will bond to the teeth, yeah. Like this, we just remove all this excess, okay. You will be able to see it because when we have pressed the attachment, it will show a little bit of excess, which we just need to remove. Then, well, normally what we will do if it's the patient is just etch and then we use the bond. Here we have the bond, okay? We just place it in all the teeth, okay? By using this brush, yeah? Take the brush, okay? And we go all the teeth that we need to bond the attachments, yeah? Then once we have that done, we just place the template in the teeth. And here we need to press all the attachments properly. Okay, to make sure they are properly bonded. We will do this in the patient's mouth, yeah? Normally, my advice when you do this in the mouth is make the patient bite the suction, so that way it will be pushed up. So now we can just give the light. I would like you to start on the back teeth, yes, because if not the saliva will go up. Okay, and then we go tooth by tooth, giving the light till we have everything. So once we have it, we just remove the template, okay, and we will have the attachments bonded.
1, 2, 3, 4. Let me hear you scream if you want some more. Like, push it, watch me work it. I'm perfect.
The aligners will come in these packages, yeah. You can see here. Here we will see which one it is the upper, is 7 of 9, lower 7 of 9, okay? And always you will have a note to wear this in between 1-2 weeks. This will depend on how often you are changing your treatments. Here it comes with this security seal, which we just need to open and take the aligners. This is what the patient will receive.
And you know what? I like it.
So here we have the IPR kit. This is really useful for our aligner cases. It comes with the handpiece, the bulbs to measure the amount of IPR that we have done, and all these bulbs here to perform the IPR. You can buy this in Medimats, okay? It's really useful for all our aligners cases. In order to start with the IPR, interproximal reduction, I always like to start with these hand strips, yeah? There is one is single-sided, which is the best to start opening the spaces, and what you need to do is just place it in between them and like save. I like to hand it with both sides, so you can just save it, the teeth, it's like saving it. This way we can round the contact and we don't leave contacts as flat. Then we go to the double-sided. It's useful to do this also, okay, when we have used the IPR machine, okay? For the fixed retainer, you can see we have a wire, the presettled wire. You can use that one, but I'm gonna show you today how you can do your own one by using like normal things that we have in our practice, like these ligatures, metallic ligatures, and using these two pliers. Okay, we have the option of using normal, you can buy it, or this is in case you don't have it or you have an emergency. This kind of ligatures, you can find it almost in all the practices, and it can save you from an emergency. So basically we just take both of them, okay? We place them together. We hold first on one side, okay? And with the other, we're gonna hold the other side. Okay, like here, we go all the way there. We have both, and we start rolling like this. This way we will have our own fixed retainer. If you add more ligatures, it will be thicker, okay? Here what we will need to do is just measure it. We measure the distance between canines, okay? And that's what we are gonna cut. Now we have our wire, and to place it, what I advise is to place first all these flaws, yeah? We will apply, of course, the teeth, the surface is already etched. We will apply the bond, and then we just place our fixed retainer, okay? We give them a bit of a shape, which is no need, because now what we are gonna do here is with the flaws, okay, we just pull it and place it down, yeah? We go this tooth by tooth, it will be placing in position, yeah, here. So here we have all the flosses with the wire there, tight. We just hold all the dental floss, okay, and then we just place the flow and light.